Hi everyone, happy Saturday. I hope you guys are enjoying your weekend and I appreciate you tuning in. Every time I go live, I say, okay, this is going to be the last one. And then another topic comes up and here I go again. And so I appreciate you guys tuning in, and I of course always appreciate all of the kind words that you guys send my way. I have no reason to spend time making these videos other than to help people within the community, but I will say that it does make me feel really good to know that there is a way that I can help our community as we navigate through these crazy COVID times. And so today's discussion is going to be revolving around school, as that has certainly been the talk of the town. And I think that pediatricians across the country have been repeatedly asked the question of what would you do? And I know even yesterday during clinic, I saw 21 patients and I must have had at least 18 different conversations about school. And so I thought I would try to use this platform to offer as much guidance as I possibly can from a pediatric perspective. And speaking of perspectives, I want to share the different perspectives that are out there because I know that it often helps me when I have a difficult decision to make. And so first, let's talk about our kids. They are, of course, our main focus with most of the things that we do. And we have been so lucky that our kids are developing relatively mild illness to no illness at all when infected with COVID-19. And this is why we're even talking about school, right? If this illness was affecting kids dramatically, nobody would want their kids to be back in school. There is a growing body of evidence that suggests that children do not spread this virus the same way that they typically do routine colds and the flu. And it seems that there is a spectrum of infectivity ranging from asymptomatic kids spreading the least to symptomatic kids to asymptomatic adults to symptomatic adults. And when I refer to kids, I'm specifically talking about children 12 and younger. The younger they are, the less they seem to spread this infection. And when we talk about schools, I know that we often lump K through 12 together. And this is an important distinguish that has to be made because high school kids will likely spread this infection similar to an adult as compared to a kindergartner. And we all know that our kids have suffered greatly by being out of school. It's not just academically, it's socially, it's emotionally, it's cognitively. For some, school is a safe haven. It's a source of food, it's a source of security, and we have taken that away. And so I think that we can all agree, just as the American Academy of Pediatrics suggested, it should be our goal ultimately to get our kids back in school full time. So far I think we're all on the same page. Let's now talk about a parent's perspective. As parents, I think many of us are over it. This has been a hard time for all of us, regardless of your opinions on the virus. Many of us, myself included, have discovered that we're not very good teachers. And we are eternally grateful for what all of our teachers and educators and administrators did for us when schools first shut down. But now we want them to take over and do what we were not able to do. We all want what's best for our kids. And for those of us who work inside or outside of the home, we want to go back to work and we want to know that our kids are well taken care of. But it seems like that is where the similarities end. Some parents are terrified of this virus, and they cannot imagine sending their kids back to school amidst a pandemic. And other parents see the virus as an issue, but they feel that having their kids out of school is a bigger problem. And then there are other parents who fall somewhere in between that spectrum, but they also worry about their own kids who may have a chronic medical problem, or they have other young infants at home, or they have pregnant mamas at home, or they have elderly grandparents who live at home with them. And in my eyes, honestly, these are all valid stances, and it's important that we continue to respect each other despite different concerns about the virus and how it may affect school. So the last perspective, or almost the last perspective, is those from teachers. And honestly, I was ignorant about this perspective until I actually started talking to the teachers. And I think it's fair to say that many teachers miss being with their students, and ultimately they want to be back in their classrooms. Some may be ready to go yesterday, But many of them feel that this is an uphill battle, and these are some of the fights that they are up against. They have to be indoors with anywhere from 10 to 30 students for an extended period of time. If you've looked at Aaron Bromage's reports of how one person with COVID-19 can infect 9 other people during a 1-hour dinner inside of a restaurant, you can imagine the teacher's concerns for being indoors with 10 to 30 students in a small classroom for several hours a day. The teachers are wondering what will happen if they get infected, sick, or hospitalized, not only for their personal health, but how is this going to affect their pay or their job security? They're wondering if their own pre-existing medical conditions or their age is putting them at risk for more severe illness. And they're wondering how to balance that with going back to work and getting a paycheck. They're wondering how to keep their own families safe when they come home after school. They're wondering how they can enforce masks and social distancing in relatively small spaces and frequent hand washing while catching our kids up from school when they haven't been in school for 5 months, all while sanitizing everything between every activity, making sure that kids aren't sharing supplies, trying to create an in-person curriculum, but also an online curriculum, and making sure that all of these lessons are recorded with good audiovisual. They're wondering whether they need to wear PPE themselves, and if so, how are they even going to get it if the hospitals and the doctors and the respiratory therapists are all running out of it themselves. They're wondering how much of their own funds are they going to have to spend on disinfecting supplies or wipes if they're even available. They're asking themselves, how are they going to deal with parents who don't believe that this virus is contagious? And they're also wondering how much more can they ask of parents to donate beyond the school supplies that they're already buying and the snacks that they often provide. And will these sanitizing supplies even be available for parents to buy and bring to the classroom as early as next month, seeing that they haven't yet been routinely available for the last 4 months? And I imagine this is only 1/100th of the concerns that they have. But again, they're all incredibly valid, and we don't have answers to them as of yet. And finally, let's talk about our administrators. They have the tumultuous task of deciding what is the right thing to do without any one model as a frame of reference, because we've never had to do this before, right? They have to establish school policies and procedures based on relatively vague guidelines or impractical at times set forth by the AAP or the CDC. They have to plan for every possible situation, from when a student is infected, a teacher is infected, a custodian is infected, and how to figure out when and how to shut down a school quickly but effectively. They have to figure out where to get funding to implement all of these new guidelines. And they, like teachers, will often have to suffer the wrath of parents who disagree with their decisions. And of course, let's not forget that there are politicians and the CDC and the AAP who are all weighing in heavily on these decisions. So needless to say, it's not very easy for anybody. And while other countries have opened up their schools, or perhaps they never even closed them at all, they have all done so with different policies in place. It doesn't seem as though one plan is working for everybody. Some have social distancing, some don't. Some have masks, some make it optional. Some close when even one student gets infected, and others stay open when multiple students or teachers are infected. And there's honestly very little data to draw off of and help figure out what is the right option. What can we do to make sure that our schools don't close again? And I will say that a few trends have been noted, and these were outlined well in Science Magazine. And that is small cohorts of children who don't commingle with other cohorts, some degree of social distancing, and wearing masks. As I mentioned, young children don't seem to spread the virus very well, and this is a very big and, the success of opening, meaning that the school does not have to close back down, is based on how much virus is circulating within that particular community. Germany opened up its schools when they had a case rate of 35 per 1 million population. Right now, the US, from coast to coast, has 1,100 cases per 1 million. And we know that that number is much higher in certain states where the virus is surging. So now I want to talk about what's happening here in Kern County, where I live. As many of you know, our caseload is dramatically increasing. We've had more than 200 cases per day for the last several days. Our testing capacity is now being pushed to the limit. For most people, it's roughly 4 days just to get an appointment to be tested and another 7 to 10 days to get your results back. This makes it almost impossible to isolate a case, quarantine cases, and limit spread of the infection if we don't even know that they're positive until 14 days after a symptom develops or after they've been exposed. Our hospitals are also filling up. Just this past week, some hospitals here in Bakersfield had to divert ambulances away from their ERs, literally closing the ERs because they had no more room. Patients are waiting in the ER for hours. Of one case, 48 hours in the emergency room as they wait for a bed upstairs. Another case, someone had to wait inside of the ambulance for 6 hours before accessing a bed. Whether or not surgeons are now allowed to perform their elective surgeries is now being assessed on a day-to-day basis because there are just not enough beds to accommodate extra surgeries. Staffing of our open beds with available nurses has also become an issue because many are sick and they're out of work for 14 days. Many traveling nurses are now being sent to locations where COVID is even worse than it is here. And if you don't have a nurse to staff the bed, you essentially don't have the bed anymore. And PPE is running out. So if you can believe it, 6 months into this, we are still not having access to the adequate amount of protective equipment that we need to wear when taking care of these patients, which again is why our staff is getting sick from it. Our death rate here in Kern County continues to hover between 1.5 and 1.6%. And remember, a 98.5% chance of survival might sound good to you when we're talking about one person. But this isn't a math test, guys. A 1.6 mortality rate, a 1.6% mortality rate with a virus as contagious as this is mind-bogglingly high to medical professionals. And the reason is because COVID-19 is not cancer. For every one person that has COVID-19, the R0 is now estimated as 5.7. That means that for every infected person, he or she can potentially spread it on average to 5.7 people. And this is much higher than we previously thought, but was released just this month in the Journal of Emerging Infectious Diseases. So while the threat of a 1.5, 1.6 mortality rate to 1% is not very high, with the way this is spreading, we are talking about a lot of deaths to come. And that's exactly what we've seen in the US as we approach 137,000 deaths in the last 6 months. And some may say, well, I've seen charts that say that the death rate is improving. And that was true, namely because older individuals and those at risk were starting to exhibit more caution and staying home, and also because healthcare workers were starting to figure out the subtleties of this infection and how to manage it better, even though we don't have an effective treatment per se. But as hospitals start to fill up again, and as people start to access or lose access to healthcare, that trend in deaths is now starting to point upwards once again. And it's affecting our community as well, not just a remote state 3,000 miles away. So, and speaking of mortality rates, since I am a pediatrician, again, we are so fortunate that the rate of death in children from COVID-19 is exceedingly low, 0.01% for kids under the age of 14. But I will be honest with you, it doesn't mean that an infected child goes without complication. And when parents, as parents, I should say, we naturally fear the worst for our kids when you are told that your child has COVID-19. You understand the statistics, but you stop caring about the numbers because it's your child. And even a 1.6% chance is far too high. A 0.01% chance is too high, because what if you are that 0.01%? And even if your child doesn't get very sick and thankfully doesn't die from this illness, it still means parents have to take 14 days off of work to quarantine themselves. And that is no small issue either. So here we have this difficult situation of attempting to open school safely in 1 month in a community where the virus is not controlled. So here is the advice that I can offer to you as a pediatrician. As you weigh out the different options that are presented to you for school for this upcoming school year, assess what's happening in your own home. Certain situations may warrant a full-time homeschooling-based learning process. Perhaps that's because you have a child with a serious medical condition who is immunosuppressed, such as with cancer or leukemia, cystic fibrosis, organ failure, or who has an organ transplant. Perhaps it's a situation where other members of the household are very elderly, or they have serious medical conditions like the ones that I just mentioned. Or if you are a parent that vehemently disagrees with the policies that are being set in place, such as mask wearing. Or last but not least, and I think this is a very valid issue, is that you are terrified of this virus. And that is okay to admit that you're scared of this virus, because quite honestly, I am too. And if sending your children to school is going to create more anxiety within your household, and you yourself don't see yourself being an effective parent because you're sending your child to school day in and day out, and you know that you have it in you to homeschool well, then that may be the option for you. Now, there are other family situations that may warrant a hybrid option where kids go to school part of the week and they do virtual learning part of the week. And this may be for parents who want their kids to be in school, but again, are still worried about the heightened risk of COVID-19. Perhaps it's that there are kids or other family members in the home who don't have as severe as medical conditions as what I just mentioned, like cancer or organ transplantation, but they do have conditions that could cause more severe disease, such as uncontrolled asthma, valley fever, diabetes, heart disease, and last but not least, situations that would warrant full-time school. Well, we have some parents that have to work full-time, and they can't take a week off of half a week off of work or homeschool their kids. And if they don't work, they don't make money. And if they don't make money, they can't take care of their families. For those kids that rely on school for safety and security and food, and that's a very real option that we have to think about. And even for families where Wi-Fi and devices are not a guarantee, because you can't have virtual learning if you don't have Wi-Fi and you don't have a device to learn off of. And so I'm not sure if any or all of these options will be made available to you as a parent when school opens. But hopefully this small discussion will help you at least lean towards the right decision for you and your family when the decisions do come to the table. And a few more side notes that I wanted to talk about. Asthma. So asthma is very prevalent, both in kids and adults here in the Central Valley, and this is considered a risk factor for a more severe COVID-19 illness. I would recommend to you that if your children has asthma, or if you have asthma and you're a teacher, that you see your doctor or your child's doctor for an asthma check. Ensure that you or your child's asthma is under good control, meaning that nobody needs a rescue inhaler more than 2 times a week. Make sure that you have an adequate supply of your refills and medications and devices such as aero chambers and nebulizers, because you don't want to start running out of these when everybody else is sick too. You want to make sure that you have them and you're using them appropriately. Number 2 is masks. So I covered masks in detail in my last video, as well as in a post that I did a few days ago, maybe a week ago, about some tips and tricks to help your kids learn how to wear a mask. And while I know that this is a touchy subject, I personally am a proponent of masks for kids in school while they are indoors. In my office, we have all kids in masks over the age of 2. And I'm telling you, they are rock stars. They do it. They are able to figure it out. Wearing masks is very much a learned behavior, and kids will follow suit if parents are willing to work with them. And I do feel this is a simple but crucial step that will help to keep our teachers safe, but it's not our teachers' jobs to enforce them. We should be the ones working with our kids now to teach them how to wear these masks. And so I know a lot of people want to know, well, what am I doing as a mom and as a pediatrician? And most of the time, I think that my opinions are not really relevant, but I know that parents often find solace in just hearing what it is that I would do based on my education, my experience with kids, and having my own kids. And I will say that I am sending my kids back to school in the fall or next month in masks full time. But I will also say that my kids are in private school, so their classes are smaller, which makes distancing within the classroom easier. And while the data I know shows that kids don't seem to spread this illness very well, I can't say that I'll be allowing my kids to see their grandparents in those first few weeks of school because I don't want to take that risk as of yet. I need to see how this plays out. Oh, I hope you guys are still there. Okay, so in my heart of hearts, from a medical standpoint, I do think that it is premature for us to open here in Kern County. But that's not my decision to make. It's my job to work with what's given to me and to help others however I can. And when I say that it's premature, what I worry about is how can our kids learn consistently if their classrooms are going to be closed for 14 days every time a child in that class tests positive. I don't know if that's what the case will be next month, but I do know that as more children are testing positive here in Kern County, public health is closing the child care class where that child tests positive. And if that continues in the fall, how can kids learn if every 2, 3, 5, 7 days their classroom is being closed for 14 days and they have to keep switching back and forth to virtual learning without a consistent schedule in place? So as this rolls out, just realize that we will continue to be faced with one situation after the next, and again, none of which we have ever been in before. More mistakes will be made, and unfortunately, more lives are going to be lost. But please remember that it costs nothing to be kind and respectful to one another, regardless of our differing opinions. And as trying as and as difficult as these 4 months have been, we have more work to be done, but we'll find our way out of it. And the sooner we come together, the sooner that's going to happen. So I hope this was helpful for you guys. Enjoy your weekend and best of luck navigating the rest of this month as we get ready for school in August. Take care.